Hi, it's Dr. Fish with Colorado Kidney Care. I'm recording this video for you to help you understand how to work with telehealth and to understand what a televisit is. We're doing this because we would like many of our patients to stay home and avoid coming to the hospital or the office because that could risk exposure to the virus. A televisit is a way to meet with your doctor using a video conference technology. It works within our electronic medical record system, and so I can visit with you on a telephone with a video feed and see your medical records at the same time. In order to set this up, it does require some ability with a smartphone. You can also use an application on your computer. Today's video is going to be using your smartphone. If you have difficulty with applications on your smartphone or knowing how to use it, I would say get help. The biggest impediment to being able to do a telehealth visit is not being able to set up the technology. Find a millennial. Many of them are out of work, unfortunately, at this time because of the pandemic, and they're very good at helping you with your cell phone. When you're watching this video, you can start, you can stop, you can rewind so that you can get the steps right. There's also some documents on our website, soon to be at least, that will help you go through the process. I would encourage you to do this ahead of time also. When we set up the televisit, if you try to set up the technology while we're doing the visit, it kind of takes away from your time with the doctor. So do it a day ahead of time or a couple hours ahead of time. And realize that it can be frustrating, and it's new for us too. So we're learning how to use it too. The application I'm going to work on with you today is called Healow, Healow, and it works on iPhone and Android. There's also a way to do this using your PC if your PC has a web camera. You'll get email instructions and a simple link on how to do that, and it's very easy to set up also. And finally, I think it's imperative that you begin to learn this technology, especially in this time of the pandemic. Just like I've given you blood pressure medicines and explained why they're necessary, and I may have given you medicines for your kidneys or your diabetes, my medical recommendation at this time is to learn how to do telehealth and learn how to participate in a televisit. Sometimes you need your son or daughter or friend to bring you to my office for the visit, just like in that case you need them to help you possibly get this televisit thing going. So don't be afraid of it. It's going to make you feel reassured, and you'll be able to see your doctor if you participate in a televisit. So let's get started. So here we go. This will only take a couple of minutes to set up. First of all, you need to go to the Play Store on your Android phone, or if you're on iPhone, the App Store. Let's open the Play Store. We're going to, in the search, we're going to enter Healow, Healow. You'll see the little blue H icon. You can click on this selection. Initially, you will see the Install tile in green. I've already installed it. So you'll go through the install process. If it asks to use your microphone or your video feed, say Allow. And at this point, I'm going to see you on the other side after we enter Open. You'll get the Healow welcome screen, which at the bottom, my screen doesn't show it, but at the bottom it'll say Get Started. The first thing you need to do is find your account. You find it by either entering the provider name, practice name, or practice code. Let's try the provider name, and I'm going to enter a zip code, search for my location, and then search for your provider, which in this case, as a test, is me. You'll end up then clicking on this. Let's try. In the second method, you'll look for me or your provider based upon the practice name. All you have to enter here is Colorado Kidney. And again, we'll do a zip code. You could enter a Denver zip code, search, and it should find Colorado Kidney Care, Lowry, Lone Tree, wherever. Click on the top location, and that should take you to Colorado Kidney Care. Finally, we're going to try the telephone number. Enter the telephone number that you know for your provider. And search that way. That's a pretty quick way to find your provider or your practice. Whichever method you use, find the practice you want and the provider you want. Now this is the logon screen. This can create a lot of problems, but it shouldn't be that difficult because there are a couple of ways to get around it. First of all, your username should just be your email address that you used to sign up to our portal when you first were seen in our office, and the password was also set at that time. Let's imagine you don't actually know your password or it's wrong, which happens frequently. I'm going to enter my email address, which is my username, and then I'm going to enter any old random password, assuming that I got it wrong. Click Log On. This is a very important screen. I've failed to enter the right password, but this gives me an easy way to get set up on the application. And that's the orange tile that says Try Easy Logon. This feature allows you just to enter your name and your birthday. I kind of wish they put this feature at the beginning and just let you log on that way. Let me get this right. For my test account, now I've entered the first and last name and my birthday, and I'm going to click Continue. It now searches for me and finds me in the system and allows me to send a text message to a cell phone with a security code. This is usually not your home phone up here. It will say cell phone if you've been registered in our system, which you probably have. My phone is receiving a text message with a secret code 4145. This is just my code for today. You'll get a different code. Then I'm going to verify that this is all correct and I'm going to log on. At this point, it's going to have me enter a new password. There are some rules for the password that you see on the screen, upper and lowercase, a number and a special character. I've entered my password, changed it, and now I'm back to the logon screen. And this is where you'll enter your username and password and log on again. So that's a quick way to recover your account and get into your account. Now we've successfully logged on. Here's my account name, and you get this kind of a pie diagram that has different elements of your medical records. You can look at your medications, you can look at your records, and when you have an appointment coming up, the My Appointments pie piece lights up as red. When this happens, you know that you've got an upcoming appointment. Let's go ahead and tap on that. My appointment's at 3 o'clock, upcoming. It's been confirmed. I'm going to click on Televisit to get things started. If I'm way ahead of time, like a couple of days, I can set myself a reminder. But let's say my televisit is just coming up right now, so we're going to click Start Televisit. And again, you may get something like a can I use your video and can I access your audio from your phone. We're going to go ahead and start the televisit, and the screen will say that we're waiting for the doctor. And now we see what it looks like from the patient's perspective with the doctor here and the patient down here. You'll talk to your doctor this way, and then eventually you'll end your phone call. And so that ends the instructions. I hope you find that Healow is easy to use, and again, if you can't figure it out, get some help. Here are a couple of reminders on televisits. Thanks for listening.